Hi viewers, welcome. This is your host, Nurse Rosin Odhiambo on Skills versus the Midwife, and today we are going to focus on the immediate care that we provide for the newborn after birth. So immediately the baby is born, we normally say that the first few hours, the first few minutes and hours are very critical. We are assuming that our mother has just delivered. So the first thing we do is that we put it on the mother's abdomen. And as we put this baby on the mother's abdomen, we expect that this baby should be able to cry. Crying is a good indicator of the functioning of the lungs. Remember, when the baby is in utero, it is not breathing. So once it comes out, the first sign that will tell us this baby is okay and doing well is that it will cry. This is where now we expect the healthcare providers to do the APGAR scoring at 1 minute. And then we are continuing to wipe the baby. Remember, as the baby is on the mother's abdomen, we are enhancing conduction of heat. These babies lose a lot of heat because of their small surface area. So at the end of the day, we don't want them to lose heat. The skin to skin, already if we begin it at this point in time, then will help also with the heat and also the bonding with the mother. So that is the reason why we don't keep the baby on the mess where we have meconium, we could be having amniotic fluid, we could be having, even blood. Okay, so we don't put the baby on the cold, we put it on the mother's abdomen where it can conduct some heat. And then again, as we are wiping the baby, remember we are wiping any secretions, and if there is need, as you're wiping the secretions and the baby is not crying very well, maybe it has taken in a lot of amniotic fluid, then if there is need, you'll have a suction tube where you'll be able to use it to remove any sort of secretions if there is need. But if our baby cries well, why not? So keep wiping the baby so that it is dry. All right, and then of course at this point in time, remember the cord is there, and there's no hurry in actually cutting the cord, because sometimes you'll realize that we'll still be getting some of the nutrients, especially the iron stores, circulating to the baby's systems. Then what we do that now, we will cut the cord. Okay, so this is my forceps that was already that is already here, that I used to just anchor the cord so that we'll be able to cut it. So once the cord is out, before this baby is taken away from the mother, remember we have to show the mother the sex of the baby. So we will show the mother, and she will be able to tell us it is a baby boy or it is a baby girl, and the mother will be able to respond. So you need to actually have her respond. Yes, it's a boy. Yes, it's a girl. All right. Okay. So this is what I want my assistant to do. Number one, I would like my assistant to actually weigh the baby. So this baby will be carried. Okay. This baby will be carried. Okay. And it will be weighed. So there's normally a weighing scale that we use, all right, so that we can be able to know. Remember, there are babies who could be born premature or they are underweight. So it would be good to know the weight of the baby so that we can know the management henceforth. So after weighing the baby, then we take it to the warm place where we are prepared. That is where we'll be able now to ligate the cord. Remember, when you were actually cutting the cord on the mother's abdomen, okay, the cord length was still a bit, too wide. So what we do is we use the cord clamp so that we can shorten that cord. We don't want the mother to go home with a very long cord. And then after that, we give the baby tetracycline eye ointment. All babies, it's routine for them to be given. Then we also give oral vitamin K. This one will just help to to prevent any bleeding disorders. Then we will use chlorhexidine, all right, solution to clean the cord. Remember, all women after they've given birth, we normally give them chlorhexidine to go home with so that they can be able to use them to clean the cord until the stump is actually falling off. It has to fall off. Then after doing that, we label. All babies must be labeled, and of course you don't know the name of the baby, so use the name of the mother to label the baby. So if the mother is called Martha, so you can call the baby Martha. And after the baby has been labeled, it will be good enough for the assistant also to help us to keep this baby warm. Here is my cape to cover the head of the baby. Put on some socks for the baby. Make sure it has it's comfortable enough so that we don't lose heat at all. All right. And then of course we want to remember to do the APGAR score at 5 minutes and 10 minutes. Remember, we are doing it at 1 minute, 5 minutes and 10 minutes. If there are any abnormalities, they'll be put down. Then again, the head to toe assessment can be done so that we can pick up. Remember in the previous episode, in the video that we had, we were looking at rationale for carrying out a newborn, the first newborn assessment, and that is essentially to help us to just assess for maturity, any complications in terms of injuries, and then also abnormalities and also adaptation to extrauterine life. And of course, when you're carrying out that assessment, you'll be able to write down anything that is deviated from the normal. Okay, and then once that happens, then it's our aim to have this baby on the breast as soon as possible, at least within 30 minutes. You remember, once you discharge this mother to go home, you expect her to be able to cope. Talk about support systems, talk about how to generally care for a newborn. And now she needs to understand that the parenting phase is here with her. The postpartum period comes with its own challenges here and there. So at the end of the day, we are here to just enlighten you on how you can cope during your postpartum period and have a happy parenting, journey. I hope all of us have a better idea on how we can take care of our newborns, and even how we can help our mothers take care of their babies once they are in and out of the hospitals. And remember, they'll be coming back for the postnatal checkup, so we will still meet them in the clinic for regular checkups. Thank you very much, and see you in the next video.